Jeff Spier. I am the CEO and president of Rio Grande Urology. We cover West Texas and southern New Mexico with around 29 providers, and I'm secretary of LUGPA. I have the task here, a very audacious task to cover the urology healthcare landscape and reimbursement in 10 minutes. So I will run through this quickly. I'm available afterwards if anyone wants to discuss some of the points that I'm going to make. So just briefly, I'll just run through what LUGPA is. A lot of you, I hope most of you are familiar with LUGPA, founded in 2008. And it was initially founded with the idea of independent practices of 10-man groups or more, but we have merged and morphed into more of an all-inclusive organization, all comers from 2 men to 95 physician practices. So, of course, the pillars of our success have been to promote best practices, the business of urology, of course, and I'll focus on health policy and advocacy today. 155 groups in 47 states, 2,100 urologists representing 20% of the total practicing in the United States, which is 1/3 of the US urology volume that are seen by urology LUGPA groups. We promote independent urology, of course, but we're also here today, and I hope at the end of this 10 minutes that you'll understand that we're trying to promote the house of urology, that we have to come together. The last discussion, by the way, this morning has been terrific. I commend you, all of you, but the last discussion sort of was granular. I'm going to kind of put this all into perspective at the 30,000 foot view, because all of the stuff that was just discussed, it depends on what we're doing together and how we're going to get there on the reimbursement front. So we're a trade rather than a professional association. So members are independent urology groups, not individual urologists. And we embrace the dyad model. This is very important. Our administrators and leadership are our advocates, not our adversaries. And so it's all about coming together for the good of the group. And again, like I said, the business of medicine takes center stage. So let's talk about what we're focused on and what I'm really proud about, what LUGPA has done, which is, we're known to punch above our weight class, but we need everybody's help, whether it's 50 people or 60 people in this room or thousands in a conference. We need all hands on deck, because we're dedicated, as we all should be, to developing deep relationships in DC. We are obviously on all the time working with our legislators because we all are facing challenges in urologic care. You heard a lot about that today, and we're influenced by what happens in DC. And it's true that we work for the government, regardless of our quote-unquote employment status. We are all in this together. And we feel like there are some uneven playing fields, whether that's site of service differential issues or the 340B drug advantages and further disadvantages that we see happening now and potentially in the future. So this says it all. Ladies and gentlemen, if you are not at the table, you are on the menu. So we all have to be involved and get this moving. I'll just highlight, this is a lot to cover. These next 2 slides are busy, but I just want to highlight what we are doing on your behalf, which is fighting for the sustainable physician reimbursement in Medicare. We're trying very hard to reform MACRA. We definitely see flaws in MACRA, so we're constantly fighting on your behalf, maintaining access to cancer therapies, whether that's to maintain the ASP reimbursement for Part B drugs or reversing CMS regulation that has been preventing some in-office dispensing of Part D drugs, promotion of site-neutral payment reform. And we're also trying to provide clinical evidence that's science-based on either whether that's molecular urine testing or if it's diagnostic genetic testing, which is getting pushback. And so we are constantly trying to provide evidence that things are working out for our patients, and the legislatures needs to see this. And of course, as mentioned earlier, the pandemic-related healthcare waivers and we're going to continue to fight for them to become permanent. Another busy slide, so I'll just hit on the hot topics here. So as far as the Medicare fee schedule reduction, CMS reduced the fee schedule by 2.28% in 2024. This affects reimbursement. We have got to figure out a way to attain fair reimbursement. We are all working way too hard, and this is essential to maintain our medical practices. MedPAC has been an advocate of ours. And another example is payment uncertainty. 19% of Medicaid visits are unreimbursed after the initial claims. And this is interesting because in the last 20 years, there's been a 26% decline in reimbursements. This is adjusted for inflation, of course, but our operational costs simultaneously have increased 47%. And this affects everyone, small independent practices, large practices, academic centers, I don't care who you are, this is affecting all of us. These rising costs are becoming unsustainable, and it's leading to healthcare consolidation, either vertically or horizontally, and these trends cannot continue. Most recently, there's been a 2.8% proposed cut in the 2025 fee schedule. And so again, our efforts are very important to make this front and center. So what are the challenges that we face? A lot of the stuff that was discussed this morning, again, this is a macro perspective, but we're all working way too hard. We have to work smarter, but our volume has to increase to make up for these reimbursement deficiencies. The rising regulatory burdens, whether that's federal, state, or local, health policy changes seem to come every 6 months. They don't understand the clinical advances that are taking place and the technological advances that are taking place, the costs that are associated with those. And there seems to be this shift away from teamwork and collaboration towards this lone wolf, all about me mentality, which we all have to figure out and come together. Whether you're an independent, hospital employed, private equity, consolidation is real, and recent studies have shown that consolidation increases healthcare costs at the detriment of patient care. These are real studies that have been published in the last 2 to 3 years. We have federal barriers, and then of course you're looking at one of them, the silver tsunami, which is the manpower shortage. Retiring ages are happening earlier and earlier. Burnout is real. We talked about that again, was discussed earlier, in that resilience and burnout are hot topics now at every conference that I go to. And then of course the work-life balance. The younger generation wants to have a life. And so we have to recognize all of these things, all of these challenges that are going to affect each and every one of you in this room. So why does this matter? Because the future of urology and all medical practices, folks, is at a crossroads. And I personally believe that society, although it's changing in many good ways, in other ways it's been difficult, especially on the medical front, whether that's prior authorizations that we're dealing with, EHR struggles. I hate to be Debbie Downer. I think there's a bright side coming, but we have to be honest with each other. And the physician-patient relationship is being affected. This is done by governmental, third-party payers, that they've all changed the way we practice. So it's a slippery slope, everybody. And this is, in my opinion, has led to and will potentially continue to lead to diminished quality of care if we don't do something about it. The good news, there have been some major strides towards coming together. Talking to Fernando, he's invited me to some South Central section meetings. LUGPA strongly believes that we have to join arms and figure out how we can come together with either the AUA specifically, but this organization, this Community Practice Alliance, was formed last year. You see the following participants. It was a huge success, and I believe this is the only way that we're going to make progress, is to come together. So we are creating synergies. I know that whether that's 1, 2, or 20 people in this room, spread the word. Let's figure out a way to continue to lock arms, and there are ways to do that. Of course, from an advocacy standpoint, it's easy. And it really starts locally. I don't mention this in this slide, but you can start with your local representatives. Have your congressperson come to your office, come to your clinic. Show them what you are doing on their behalf and how you're serving their patients. I'm not gloating, but in El Paso, Texas, we're isolated. We have, close to, our patient population is excessive, but we're providing care that I'm proud of. And so we try to invite our legislators to our offices, show them what our Advanced Prostate Cancer Radiation Center, in-house pharmacy, pathology, all the things that we're doing to to promote our patients' care. That's number one, and that's not mentioned enough. So get in on those fly-ins with the AUA or LUGPA, and let's do this together. So I'm very bullish about the future. And again, Fernando, thank you for the invite, and I appreciate being on stage with you guys. It was a great morning. Thank you all.